Great, good evening, everybody. Is that extra loud? Welcome to the Health and Human Services Council Committee meeting. Today is December 4th. It is 5 p.m. and we're here in Everett City Council chambers. The members of the public are more than welcome to join in attendance here in chambers. However, public comment is not taken during committee meetings, but folks are always more than welcome to share their thoughts via email to council or join for our regular public meeting at 6:30 to provide public comment. Tonight we have two topics on our agenda. The first is an update from Compass Health, who's here to share more about their new facility and also work that they've been doing with the current facility, Andy's Place, over off of Broadway and Lombard area. And so we have a couple guests tonight. If you wouldn't mind introducing yourselves and sharing your name for the record and title and all that fun stuff. And I believe you also have a presentation today if you wanted to kick things off with that. So go right ahead.
My name is Tom Kozaczynski. I'm the Chief Advancement Officer at Compass Health. I oversee the fundraising and then the public relations work, and here with Tom Sebastian.
Hi, I'm Tom Sebastian. I'm the CEO of Compass Health. Thanks for giving us a chance to come and give you updates and answer questions you might have about our project on Broadway. So I thought maybe I would just kick in and start with a little bit of background in case you're not super familiar with Compass Health. So we're a nonprofit behavioral health provider. We serve the 5 counties of the North Sound region, so Snohomish, Skagit, Whatcom, Island, and San Juan. We have over 26 licensed facilities in those locations, and we provide a array of services to children, youth, families, and adults. And that ranges from general outpatient services to mobile, 24-hour mobile crisis outreach. In the 4 northern counties, our staff on the mobile crisis outreach teams also do the assessments for involuntary treatment, as well as a myriad of intensive programs, both for children, youth, and also, thirdly, for adults. I would say that is what our greatest competence is. A lot of folks can do outpatient therapy, but our specialization is really for people of all ages who have really significant behavioral health challenges and need a range of services and supports to thrive in the community. So in 2023, we served almost 12,000 community members. Those 12,000 community members received over 218,000 we called points of care, which means a service that we provided to them. And of those, 22.5% were enrolled in more than one program. So we really are serving folks who have multiple needs and at times need multiple programs in order to meet all of their needs and thrive in the community. So we're here to talk about the Broadway Campus Redevelopment Project, which is really our work to transform the 3300 block of Broadway into a purpose-designed campus for intensive support for community members with behavioral health challenges, adults, as well as permanent supported housing. So this was really in response to several initiatives that happened quite some time ago in the community that identified some of the most urgent needs in the community, amongst which were chronic homelessness, individuals with really significant behavioral health challenges that clearly were unhoused and struggling. And so our intent in this whole project was to be part of the solution, not the solution, be part of the solution with other partners in meeting some of those issues and those challenges. So our first phase, as we call it, was to create a permanent supported housing complex for chronically homeless adults who face significant behavioral health challenges. And that was completed in 2021. That's what's referred to as Andy's Place. So that is an 82-unit permanent supported housing complex. And it's on the Lombard side of the square block. And really is intended to create an environment for some of the most challenging to house community members, and that's what we've been doing. and it has been that. So we completed that in 2021. And then I'll talk a little more about Andy's Place, and then also talk about the next phase, which you may have noticed is under construction. And that's a purpose-designed facility on the north half of the block on Broadway. It'll be about 70,000 square feet, and I'll describe to you some of the services that we'll be providing there and why that phase of the project is not only vital in terms of services for the community, but we believe very strongly and have the intent from the beginning is going to be part of the solution of some of the challenges that we've been facing in terms of the neighborhood disruption from the services that we've been providing. So talk a little more about Andy's Place. We receive referrals for residents from a number of sources. So it's an apartment complex. So each individual is leasing their own apartment. All the tenant landlord laws and rights apply to each of them. We do have staff to support those individuals 24 hours a day. And we receive referrals from three main sources. One is through the Snohomish County Coordinated Entry, which I'm sure you're familiar with. And so for those 61 units, Compass Health has no say in who rents those apartments, right? They come in through the process, they get to the top of the list, they're placed into a unit. And so really that's where our engagement with those individuals begins. We are in dialogue with the county about how we can partner better with them to make sure that we're receiving referrals that are appropriate for an independent living situation. I will be honest and candid. We have people moving in that need a much higher level of care than we're able to provide, but we have no way to screen that on the front end. And then once they're with us, of course, we have the obligation to provide care to them. And then they have all the rights of any other tenant in the community. And so I would say that has been a challenge. Additionally, we have been very pleased to have 10 units that are designated for veterans and funded through the VA. And then we have, there is a Department of State Government called Aging and Long-Term Supports, and that is really focused on individuals who've been spending time in institutional settings that have very significant behavioral health challenges, adults, and they're ready to transition into independent living in the community. And so they are funding 10 of the units. So those are folks that are moving out of either Western State Hospital, perhaps an adult family home, or some other sort of more institutional setting. So again, we have the services that we're providing through the residential staff, which is primarily funded through the rental collection that we receive and the subsidies that we receive for the tenants that are living in the building. Additionally, we had to displace all the program, or find other homes, let's put it that way, for all the other programs that were existing in the site that we demolished. And so we had space in the north half of the first floor at Andy's Place. And we thought it would be useful to move in our intensive outpatient team. One is it was a ideal location for them, and also would provide a little more clinically trained staff that would be on site at Lombard while we went through the construction period. And to answer a question you had, those folks, the staff and the clients, will absolutely move into the new building on the Broadway side once that's completed. Maybe I'll keep going and then we can get to more specific questions. So we totally have heard neighbors in terms of disruption in the neighborhood. Some of what our neighbors are experiencing, we are experiencing as well. Individuals that should not be on our property, should not be doing the things they're doing on our property. So we not only know that we have had impact in the neighborhood, but we've also know that our residents have been impacted by some of the activities going on in the neighborhood. So we've really thought about this in three ways. One is, what's our outreach to the neighborhood to make sure we hear what's going on? what can we do at Compass about our operational standards and how can we improve the work that we're doing in order to respond to what we're hearing? And how can we create partnerships with law enforcement, the city, neighborhood leaders, in order to work together to address some of the broader issues in the neighborhood, which are not specifically related to residents at Andy's Place or our clinical program, but we are affected by those issues in the neighborhood as well. So that's really been our approach. So to start off, what we worked at was tried to create, and we had to work and improve this over time. It wasn't, we didn't get it exactly right out of the gate. But what we've been trying to do is create channels for individuals living in a neighborhood when they have a concern, that they can let us know about it and know that we will respond to them in a timely way. And so we created a dedicated email for the neighborhood. This is because we heard originally we had them go to our website and go to our sort of the general place where anyone in the 5 counties could communicate with us about a question or concern they have. And we heard that was a little too, it wasn't easy to use. So we created a dedicated email for the neighborhood, as well as a dedicated phone line where anyone can call in, leave a message about a concern they have, and then we review those and again, respond in a timely manner. We've sent out mailings in order to let the neighborhood know about those channels of communication. There are times where we're dialoguing directly with neighbors, and then we, of course, are joining neighborhood meetings in order to make sure we're opening up as many channels as we possibly can. So in terms of our operations, we've done a lot of changes with security. I'll say we didn't necessarily plan on even having security at the site, and I'll be frank, there's no source of funding for security at the site, but it became evident that was going to be needed both for the safety of our clients and staff, but also for the neighborhood at large. And so we have security staff on 24/7. During the busiest hours, which are business hours Monday through Friday, we have 3 security staff on at all times. Those security staff are instructed to patrol on a regular 15-minute cycle. They're trained through their company that they work for to work specifically with behavioral health clients. That company works with other permanent supported housing providers and other behavioral health centers. We have, from the design, it's a secure building. You have to have a key card to get in. So we have worked to amend over time what the visiting hours are, where can the visitors go, where can they not go. So for example, one of the recent changes we made in the last couple of months was we have a internal patio, outdoor area that has a place where folks can go smoke. We did not allow visitors to go use that area because we don't know who they are in terms of interacting with other residents in the building. So then the only alternative, of course, was to go outside. And that was not working well for the neighborhood. And so we changed that, and we now have visitors able to go in with the residents and smoke in the internal patio as a way to hopefully mitigate some of those issues. We're doing a lot of education with the clients and the staff about the buffer zone that's around the site. And we are making it very clear to them what the requirements are around the buffer zone, making sure they really know the amount of time they have to be outside and the amount of time before they need to move on. So that's just a regular part of what we're doing with everybody since the buffer zone has been implemented. Sorry if I'm moving quick, but I want to make sure I know you have other agenda items. So what we've really been working on building is a greater partnership to make sure we are being even more effective in terms of the things that we're doing to ensure safety in the neighborhood. So we've been meeting with the city of Everett and the Everett Police Department twice a month for almost a year. And at those meetings, we've been working on the context we used was we were required to submit a management plan as part of the getting permitted to build the building. So that became the tool we're using to go through and figure out, okay, now, here's this area, security, and how are we gonna work, and what are we gonna do, and how are we gonna hold ourselves accountable to what our standards are around security. And so that's just one example, communication, et cetera. And also then just problem solving around times a day where there were particular challenges. So we identified for some of our clients, they're required by Social Security to have a third party manage their funds. So that's a service we offer, protective payship it's called. And so there's a day of the week when folks come and would generally get their checks for spending money or groceries. We noticed that was a time where they were being victimized on our property because those that are not associated with companies quickly learned folks had money coming down the street. And so we worked with the Everett Police Department, and they were great, and they began to provide enhanced patrols during those times, and it had really clear impact. We talked about parking enforcement, and we have noticed a real improvement as Everett EPD has worked to really enforce those parking standards, because we had folks just parking out on the street and camping out, and that was an issue. We also have been working much more closely recently with the Everett Station District Alliance. We are a member of the BIA, the Business Improvement Area, and so we have been working that to figure out, together with EPD, they've, by the way, recently added enhanced patrols on Saturdays and Sundays when we have less security on site. And then we're working with the outreach staff from the District Alliance in order to, overlap's not the right word, I think layering would be the right word. Tom's been leading this effort for us, where when at times EPD is not doing enhanced patrol, the SDA staff are able to do more on-site monitoring of what's going on around our property. Did you want anything to that, or parts?
I'll just add that the Everett Station District Alliance folks have been fantastic to work with. You have to keep in mind that they are also, the ambassadors are private security force, right? So they have some limitations in what they can accomplish when they're actually on site, but I think we've really focused on having a closer partnership with our own security, and as Tom mentioned, making sure that we're using the available resources wisely and doing that layering. And as one of the 5 largest BIA ratepayers, not implying at all that, you know, we're any more important than anyone else, but certainly that was a decision that we made to be part of that effort, and are now, I think, working very closely to make sure that that is a useful tool for not only Andy's Place, but then moving forward with phase 2.
So then, another new thing we've implemented is, and we've just had our first meeting recently, is we have established a specific neighborhood advisory group just for the Broadway campus. So it includes the City of Everett staff, Everett Police Department, the District Alliance, a neighbor from across the street, and Andrea Tucker, who's the head of the Port Gardner Neighborhood Association. And I'm sure we'll add other people over time. So we had our first meeting just a little while ago, took a tour of the new building under construction to hopefully give some vision on how that building will be part of the solution moving forward. So I better move on to that right now. So one of the unfortunate things that happened was that we were not able to relocate our crisis stabilization unit from the former site before it was demolished. We had a licensed facility that we were leasing, but and had the proper licensing, but weren't allowed to move into that space. So that's a critical resource we lost during the construction period. So particularly for the Compass residents and clients who police will interact with, who are experiencing a behavioral health crisis, they're now in the position to have to take them to the emergency room, or make some other disposition. As was the case before, and will be the case again, except with a much more secure, a much more properly designed facility, we will have that resource right there. And so we now have clients that are going into crisis that we're calling 911 ourselves, because those folks are in crisis, because we don't have the resource available to us to walk them across the alley to get the care that they need. But we will have it, and it will be properly designed, much more secure, and certainly reflect more respect and dignity for the community members we're serving and for our staff. So that will be it.
So with that unfortunate closure, how far are folks having to travel now to receive that intensive and crisis care?
The closest crisis stabilization center would be in Bellingham. And so as we thought about the design of that building, the entry for first responders at the new site will be through the alleyway between where our, sort of down the hill, and masked by the buildings that are up. So we've really tried to be thoughtful about, okay, even as we put that into place, how do we do that in the least disruptive way to the neighborhood, so that it's safe and secure. So basically, there'll be a drop-off for law enforcement. There'll be an elevator that go straight up either to the crisis stabilization unit floor, or we will also have a floor that'll have involuntary treatment beds for those that are found to be a danger to themselves or someone else. That's a completely secure floor. It's a locked facility. In these facilities, people don't come and go. These are secure facilities. When you come to us, that's where you're staying while you're stabilizing. And in the design, we will have some beautiful outdoor space on both of those floors for folks to be able to go outside while they're staying with us. We'll also be housing all our intensive outpatient teams serving Snohomish County, including the involuntary treatment team that's currently on Lombard. They'll move down into the building. And so we are anxious to complete that construction. We are at about 70% construction completion. That should be completed in May. We hope to get the furniture, fixtures, equipment in, and everyone moved in by end of July, early August. So can't come soon enough.
And then, Tom, how many beds will be at that new facility?
There'll be 16 crisis stabilization beds, and there'll be 16 involuntary treatment beds.
Okay.
And the reason for 16 is a very crazy federal rule for programs that receive Medicaid funding.
They usually are pretty crazy.
Yeah.
Then, what's the staffing plan for the new facility? Because I know there's also workforce shortages and challenges, and so if you could share more about how the new facility will be.
Sure,
staffed,
yeah,
that would be
it's
great.
one of the parts we're excited about, and you have some renderings here too, is we think having a facility that's really created at the level, again, that is designed for the work that we do, and also designed in a way to be welcoming, therapeutic, but also create an environment where people will want to work. And so for the to state the obvious, for the programs that currently exist, they'll be staffed as they come in. And then we will be, starting in the spring, we'll start the staffing process for the two 24-hour beds. And those are very richly staffed programs because of the nature of the community members we're serving. So they have nurses on every shift, as well as psychiatry coverage, peer counselors, therapists, recreational therapists. So it's a very robust staffing pattern. We run an involuntary facility in Mukilteo. So we've been doing that for 30 years now. So we know how to run these units. We've been running crisis stabilization at that site for probably almost 30 years. I just comment, 30 years ago, you know, myself and a couple colleagues moved into the old building, the old Bethany Nursing Home building after Compass purchased it. And the first program we started there was a homeless outreach program. And we had a drop-in center. We used the cafeteria and the kitchen. We had hundreds of community members coming to that site every day. So that site has been doing much of the same work we've been doing. I think the challenges we've seen escalating in the community, whether that's due to the opioid crisis, which I think is a primary driver, those are the things that have really changed. And it's changed for us. And so we're in a constant process of trying to figure out how is it that we move forward, meet our mission to the community, and do so in a way that's safe for everybody. So, oh, and in answer one of your specific questions, yeah, we do NA groups on Tuesdays at Andy's place, and then sometimes the structure of those groups aren't a good fit for individuals with severe and persistent mental illness. So we run a second dual diagnosis group on Thursdays as well.
Okay. Great. So with the new facility, I see here that on the slide it mentions that there will be approximately 1,300 clients per year. So I'm trying to do the math on how, with 32 beds, that seems like a pretty quick turnover for somebody to stabilize. Can you share a little bit more about that?
So two things. Some of that number will be those served by our intensive teams. And I don't know exactly the breakdown is, but for the crisis stabilization unit, generally, folks are there for a 5 to 7 day stay. And for involuntary treatment, it's basically 7 to 9 days on average. So this is opposed to community members going to Western State Hospital for months or years. So if you have the proper skill set and also put in place the proper discharge plan, and I want to emphasize that, whoever's coming into those units, we're working immediately to either, if they're a Compass client, get in touch with our treatment team, figure out what needs to change for them in their treatment plan. If they have another provider in the community, we're reaching out to them, making sure we're talking about what's the next step for this person as they move back out into the community. We don't just send people out the door and say, oh, your 5 days are up or your 7 days are up and see you later. We've had at times people stay for 60 or 90 days because we don't have a proper plan in place for them.
Tom K., you look like you're about ready to add something.
No, Tom jumped in and answered the one, your primary question. I will also mention that the one statistic that I can give about the crisis triage facility and the evaluation and treatment facility is that over 50% of the individuals that are coming to that are coming from either Swedish, Edmonds, or Providence. And so really underscoring how important that is also not only for the hospital system and make sure that the beds that are being used in the emergency room are for people who are in immediate medical crisis, but then also for the first responders who are not going to be tied up waiting in the emergency room for admission. So Tom did answer the other question about the intensive outpatient program and the ECS program. So
Great, thanks. Councilmember Tui?
Yeah, I have a question about the new facility. So there's the 32 beds, and then will it be also serving drop-ins throughout the day?
No.
No, because you talked about how you guys did that
Yeah,
originally.
yeah, we no longer have the drop-in capacity.
Okay, so, but they will also be taking care of anybody at Andy's place that might need help?
Correct, exactly right.
Okay. Okay. And then I wanted to go back to the, your dedicated email and phone line. So do you have, is that a 24/7 callback or response on that, the email and the phone calls?
I'm gonna turn to Tom because he,
yeah, so we respond within 24 to 48 hours. It's generally 24 hours during business hours, and Monday through Friday. And so if we get something at 8 p.m. on a Tuesday, we'll generally see it first thing in the morning on Wednesday. Both the phone line and the email are monitored by at least 6 people on various teams. We have to obviously respect the privacy of some of our clients and, HIPAA regulations if we can't disclose at times if someone's under our care, but I can assure you, with the exception of one email that was caught by a filter, we've responded to every single comment that we've gotten from the neighbors, and then that has gone to the respective teams to review that.
So I guess my question kind of is, during when there are no office hours, it's beyond that, and there's something happening in the neighborhoods, who would they call besides 911? Do you guys have a resource available for them during those off hours?
The other alternative to 911 would be if one believes they're seeing someone in a crisis situation, then it would be calling the Volunteers of America Care Crisis Line. So in the other four counties, then we would be responding because we provide the 24-hour mobile crisis outreach. In Snohomish County, the county itself has a team that responds to behavioral health crises 24/7.
Okay, and then, so you have security 24/7?
Yes.
And are they visible outside or are they just more inside?
On business hours, they're outside. And then mostly doing video monitoring on the off hours because we only have one person
Okay.
on the off hours.
But they're on site though?
Yes.
Okay. So, and the neighborhood, they shouldn't contact your security, is that the plan? If they needed, if there was someone from your facility and they needed to get a hold of somebody quickly, is your security person at night not available? Or are they, I guess is the question.
Well, they're up and available. We don't have a direct phone line
No
to
direct
them.
communication with the neighborhood?
Correct.
Is kind of what, okay. Okay, because I remember the one facility that we, before we put in Claire's Place, we visited in Seattle, and they did have that 24/7 phone connection with the people that were on site, so that if there was an issue, they could directly get a hold of somebody that was there. So I just was curious if you guys were doing that.
Not at this time.
Okay,
Yeah.
thank you. Let's see. I think I might have something else, I gotta find it, so.
Are there plans to have the direct line for neighbors that are seeing somebody in crisis and they maybe have a lanyard and they're a resident at Andy's that they could call to have a trained staff person come help that person in crisis and bring them back inside so then they don't have to rely on 911?
Very recently, made some changes. So we have a new director of facilities who's directly overseeing security services. That's just in the last couple of weeks. And a new chief financial officer that oversees all our facilities. So we'll be reviewing everything we're doing with those two individuals in the next month.
Okay, great. Yeah, I think another question that we had kind of leads into it from our list was just a question about how many 911 calls has been to Andy's Place in the immediate neighborhood. I think the time frame was in the last 3 months. I see Lieutenant Fairchild making his way up. So yeah, if you could share a little bit more about, I'm curious about just the quantification of how do we quantify 911 calls, overtime that the city spends on extra patrols in the neighborhood. I know there's the North Everett emphasis detail and some other emphasis work that's happened in the neighborhood. So I'm just hoping to get a quantification on those numbers.
Yes, absolutely. So over the last, I think one of the questions that was asked by Councilmember Tui was over the last 3 months, so September, October, November, how many calls for service or 911 calls have we had from Andy's Place? So during that time, it's 170. Of note, though, a third of those, so about 54, have been Everett Police self-generated. So those are either security checks that we've done, the area emphasis patrols, so where that's that Friday morning, soon to be 3 times over the weekend that Tom Sebastian had mentioned, as well as special operations that we're conducting. So the parking enforcement details. So that's why almost a third of the total calls at that location for the last 3 months have been calls that we generated, not that the facility generated. So that is actually something that helps the community. Now, as far as the other calls for service, that they're primarily going to be a combination of behavioral health, as well as some suspicious calls that come in, noise complaints. Those are kind of some of the basic issues that we're responding to at that location, if that answers your question.
Generally, I think I had an 11th hour question. I'm not sure if Jennifer had a chance to take a look at it, but it was I'm trying to get a good idea of how much it costs for security patrols. And then there's this gap between what neighbors and folks, who they can call when they are seeing a concern. And then how much the city has been spending on patrols and emphasis. And if there's a way to close that gap and meet in the middle and have other levers that the neighbors can pull to help with the right person responding, which would be a more fiscally responsible option than a police officer on overtime. Because if I see if a neighbor sees a person in crisis, they should be able to contact a staff person to come help them instead of a police officer coming from blocks and however far away to make sure that the person's getting the right care that they need and that the neighbors are being responded to as well. So I guess I'm trying to find like the dollars and cents of like, how much are you guys spending on security and how much is the city spending on response calls, and if there's a way to help balance that out a little bit better. So you kind of answered my question, but I was hoping for more of like, we can follow up later over email because I know you guys don't have the numbers on you of just what could happen to help close that gap.
We can sure provide you that information, Paul.
Great. Yeah, and I would love to for if there is a way that the neighbors could have a security person come help a person in crisis. I think that would alleviate our EPD stress a bunch as well. And while you're here, council members had a question. I mean, this might be more of an executive session type discussion about the status of the drug houses in the neighborhood. And I know we don't want to necessarily share your playbook on drug house enforcement for the public to consume, but could you touch on that a little bit? Because I know that the residents at Andy's Place, they're also being victimized by known drug houses in the area, and they're not helping. And from my point of view, I don't understand why they're still there. If it's easy for the neighbors to spot the activity, I don't understand why it's continued to fester for this long.
Yeah, absolutely. I can't touch on that. So we are aware of the numerous locations or the multiple locations surrounding Andy's Place that are drug houses. We continue to work those locations primarily through our community outreach enforcement team, our community bike unit, and our North End emphasis details. So we're not only doing the enforcement perspective, but we're also looking at addressing those locations through our administrative sergeant. Sergeant Wold is utilizing code enforcement to apply civil fines against landlords and property owners, as well as going after these locations with chronic nuisance. So there are multiple avenues that we can take to address them. They're usually not quick fixes, and that is partly constitutional requirements and protections that property owners and tenants have that we have to be respectful of, even if they're committing criminal acts.
Great. Do you have something?
You had mentioned some of the residents that you receive have increased care needs than you're able to serve. What is the, I guess, mitigation efforts you're pursuing on that? Because I imagine, one, that's financial strain, and then two, if you have folks that just have needs beyond what the intended use of those independent living apartments, it can't be great for the community and the neighborhood. So what are you able to do, and are you trying to do anything right now to mitigate that?
Well, frankly, the main thing we could do is work with the county staff that are overseeing that program, but they're also limited. I mean, this is a structure that's in place throughout the state. So this is not something we can just like locally change. But what we're hoping is that we can work with whoever is doing the evaluations and assessments for those individuals, whether there's not a way to build in some, I don't want to call it exclusionary criteria, but some way of identifying if someone has a need that is really beyond living independently in an apartment. And so we started that outreach process some time ago.
I was enjoying that long pause. Great. Yeah, I just had a couple commentaries too. I think it's more of just like, one's a disappointment and one's plan that I'm working on. I had big plans for the county's public safety sales tax. If it were to go through, I was gonna push to have some of Everett's allocation go to help with enhanced security patrols for Andy's Place. So unfortunately, that did not pass, so I'll still continue to find what we can do to help with just alleviating the pressures in the neighborhood through securing additional funding. So I guess that's disappointment with a glimmer of optimism in there. And the plan that I'm working on, with the proximity of Andy's Place to our jail, I've been working on a plan to just have better exit practices from the jail to make sure that if a person exiting the jail who's maybe had been in jail for drug-related crimes and then they're maybe detoxing and they're in a vulnerable space, that they're not walking past, like through a troubled area at late hours of the night to try and find a safe place to stay. And so I've been working with John Hull over at Everett Gospel Mission to possibly have some sort of vehicle that literally picks people up from the jail, takes them to Everett Gospel Mission. There's a secure bed, set aside bed for the night for people to stay, and then in the morning they can go back to Carnegie or get connected to services the next day. So then they're literally leaping past like a space that would prey on their vulnerabilities. So more to come on that. I think the jail had some sort of, I don't know if they do or not, it's part of the conversation, like some sort of housing navigator person for a housing plan for when they exit the jail. I'm hoping that'll be helpful. So that's one thing I'm working on, along with all of the other supports and whatnot in the community. So just wanted to share that on record.
I just wanted to thank you for coming and really encourage you to continue to work with the neighborhoods. And I know they are anxious and glad that you're here and that we're talking about these issues and how we can resolve some of them. It would be great if they had a 24/7 person who was there if, the issue was there. But we know you're working on that, and the work you do is vital, and so needed. So we do appreciate that. We also want to make it a good fit for the neighborhood. So we'll just all keep working on that and appreciate it. Thank
And
you.
we're committed to doing that. And thanks for having us, and we're happy to come back anytime to give you updates on what we're doing.
Yes, thank you, appreciate it.
Great, thank you. Great. All right, moving on in our agenda, we will be speaking next about the proposed rental registration ordinance and tenant protection ordinance that came through the committee a while back. I'm a little bit underprepared to share policy decision point responses, but I'd be more than happy to do my best and invite my fellow committee members to join in that as well.
Yeah, well, I don't have like a presentation per se, but staff did review the two ordinances and kind of brainstormed a list of policy questions. So, the first one is just, should all rental units be registered, including short-term rentals or rentals owned by small landlords? And, what's the tipping point? How would one define small? Should any properties be exempt, or should all be included? That was the first one, if there's any threshold for consideration.
Great, yeah, I think some of the thresholds we had discussed before was about if a place should be registered if the owner is on site. So if a property owner is just renting their back bedroom, maybe that's not enough to like trigger a registry. But if there was a attached dwelling unit, it's like a separate entrance, so does that qualify as a threshold for registering, or is it a detached with the owners like on the property, anywhere on the property? Then there's an assumption that they would keep the property nice because they also live there. So maybe that's not necessarily a trigger, but I think it can get murky quickly. So, and then I think another trigger point would be a number of units. So if there's owner has a fourplex, then, is that enough units that they would need to register, or is it 16 or 32 or 100? Just kind of the level and number of units, and then is units defined as bedrooms or just independent dwelling spaces? So lots of places that the threshold could be met, and I would welcome comments and inputs from committee members.
Is there any differential on whether your landlord, because we have a pushing for ADUs and DADUs, so while they may not necessarily be in the rental, like it wouldn't be a back bedroom, but if they were a local landlord versus somebody that's, I don't know, landlord Wall Street, difference there on whether we have somebody that lives within the county or the city limits, because I think that like brings out usually a different type of entity and a type of landlord. I don't know if that's ever been looked at as far as parameter.
Some of the housing folks that I reached out to, they suggested either not having a line, so it would just be like any rental at all, including owner-occupied spaces, or including short-term rentals as well. I think there had been maybe some separate policy questions about short-term rentals and how that would fit into this or not, so I'm not sure if we would want this to cover short-term rentals, because there's also like a business license question that goes along with that, but yeah, I was thinking one of the policy questions was about an exemption from registering, and I think it was maybe included in the ordinance, I'd have to double check, but I would suggest excluding nonprofits, so Housing Hope, Everett Housing Authority, because they already have, they're basically registered with HUD and other federal agencies that have stricter requirements than any of this would have, and they're already having to follow all those different parameters, so it'd be a layer of reporting obligations that might be too burdensome for them, since they're already reporting to the federal government anyways, so.
There's also properties that get like low income tax credits or the multifamily tax exemption that have to do reporting that might not be nonprofits.
Okay.
Like Devco is a for-profit company and there's lots of for-profit owners downtown that get, for at least a period of the exemption, 8 or 12 years or whatever, so.
Okay.
And I think by law, you're not supposed to discriminate on the source of the, I think by law, you're not supposed to discriminate on the source of people's rent payments as it is. So it really could be any landlord if you're taking that into consideration.
My question would be, I understand the importance of this, but I also want to be mindful of what the level of staffing would be to set it up and manage it and make sure that they're collecting all the information that they have. So I don't know if staff can project that or not. It's kind of an unknown because it's a lot of information. But does it, updated annually? I mean, that could involve quite a bit of staff time.
Yeah, during the research for it, let's see, I don't think I have that notebook with me, but there were maybe 20 or so other cities in Washington State that have done a rental registry. So I think the template is there, so it wouldn't, that part I don't think would be too big of a hurdle, but it is definitely the staff to, build the website and collect the registrations and process them and all of that. So yeah, I appreciate you bringing that up.
As we get further along, it would, if there's a city our size that we could reach out to at some point, we don't have to do it now, obviously, till we're a little closer, but, and just kind of see what that involves, what that entails for them as far as staffing I think would be important for me.
Great, yeah, I believe Spokane has one. Oh. Pretty sure, yep. Great. So that doesn't answer the question.
That's, yeah, I mean, I think that was a question the staff had too. And it's not like you have to answer, like, the point is to discuss,
Great.
generally,
Great.
so, yeah. Yeah.
Great, the next question was about, so state law requires a 60-day notice for rent increases of any size, and should Everett's policy require something different? So I believe it's written in that it would be 120 days. But I think the intent was that and it's 120 days if it's an increase of over 10%. And so the intent was to make sure that if a tenant is gonna have an increase of that size, they have enough time to prepare, especially if, because 2 months notice is not necessarily enough to adjust your household's incomes if you're paycheck by paycheck, or find a new place to move to, or anything along those lines. But a little bit longer notice would just help a household budget prepare better for when the increase does come down the pike. So I think there can be, I think as we were kind of discussing a little bit earlier about the different layers of applicable rules and policies. If the state's requiring 60, then most landlords are accustomed to that. So maybe it should go back to 60 in our ordinance, just so that there's not too many differentials and things for folks to keep track of. But and then there was also a concern that had been brought up by one of the housing folks that we might start seeing increases at 9.9% instead of the full 10%, just to skirt around the issue. So that was an interesting thing to take into consideration as well. Councilor Fossey.
Just trying to remember back to the major conversations that I heard about this when the state was kind of exploring those things. And the 10% threshold is not unreasonable, like from feedback I've heard across the board in other states and other places, because that is like a substantial increase in one's rent. I mean, if your rent is like $2,000 you're already paying, you're going to now increase it $200, unless you have a justification of like some new amenity or some major thing. That's not a usual amount. That it's just reasonable. And as far as the 60 days, I understand about the cumbersome of having maybe duality in some different laws, but if we were going to maybe focus on that, I don't think necessarily the 60 or 120 days would be the one area that I would point out to be cumbersome. I think the point is not to have people go homeless, and giving people a little bit of grace. I don't think that additional time period, we're not asking for a year in advance. So I don't think it's unreasonable, and if we wanted to look at other areas that created a little bit harsher or more complications for landlords, then there's other areas to do that in. That's my opinion.
Great. Good. Let's see. So in the interest of time,
Oh my.
before diving into the next few bullets here, maybe we can, I know there's also going to be a rejuvenation of the state's tenant protection bills that are coming through, so we might want to pause until after session. I think it got pretty good legs last time, so with a longer session, I think there might be a good chance that those might get put into place. So I think hesitant to like do a 4-month long pause, but I think keeping track of that, or at least adding it to our legislative agenda, or at least our legislative tracking and whatnot, that'd be great to make sure that we're keeping an eye on it, and if it happens to not make it through, then we can pick this back up again, or just see where that lands and see how close it aligns with what we're working on.
I'd like to second the tracking of how close it aligns with what we're working on, because knowing how things may pass different bodies can kind of give us an idea of what things are looking like, so.
Great. All right, it is 5:58, and we're adjourned. Thanks.